For those of you that are interested in what's going on with healthcare, especially if you are being or if you're ill on a regular basis or have to go to the hospital or worried that you might have to go to the hospital, one of the things that you will notice is that most of your treatment, most of the people that you come in contact with in a hospital, in a medical facility of any sort, will be nurses. Whether it's a RN, LPN, a nurse practitioner, any of those, you will come in contact more with nurses than you will with doctors. Well, for some reason, because of the big beautiful bill, and I'm against omnibus bills by all accounts, I'm against omnibus bills. There was some good that was in the big beautiful bill, but there was also some bad. One of those is that nursing degrees are no longer considered professional degree programs. Now, you may be going, well, that doesn't really matter. Well, I'm going to explain to you how this will hurt your health care. And I'm going to go off of nurse.org, but at the end of this, I'm going to explain how it could help the situation when it comes to cost for this degree. But at the same time, I don't think what I'm going to explain to you will actually be the reason why it's put into the bill. Now, I haven't found a reason it was put into the bill. I'm going to keep looking at it. I know nurses. I'm I have an inside when it comes to certain things with healthcare, and I hear nurses all the time. I talk with one particular nurse pretty much every day. There were a lot of nurses involved when my health went down a few years ago and my life needed saved. So I kind of defend nurses because, well, nurses are insanely necessary for this modern world in America. Nurses run everything. We already have a shortage of nurses. The unlisting of them as a professional degree could actually hurt the cause of getting more nurses. So, before I get into this whole thing, hit like, hit subscribe if you want to know what's going on the federal, state, or local level government. If you really want to be a help, I'm not saying you have to because the liking and subscribing will do me a lot of good. But I got a Patreon. It's in my link tree down below. Hey, if you want to. But let's get into this.
Howdy, y'all. This is Paul, the Redneck Thinker. What we have here is a channel to communicate. I want you folks to be thinking by the time you leave my videos. Why? Because I'm tired of people talking via what other people tell them to think. So, watch my video and enjoy the chance to think for yourself.
So, this is from nurse.com. And it's actually a pretty big deal for nurses. But U.S. Department of Education has removed nursing from its list of recognized professional degree programs, a move that may have significant implications for students, schools, and the future of nursing workforce. While this change does not affect the licensure or legal standing of nurses, it could alter access to financial aid and limit advanced education opportunities. Context of higher education, a professional degree is defined as a credential that prepares the individual to enter a licensed profession that typically requires advanced education beyond bachelor's degrees. These degrees usually include both academic and clinical components and lead directly to practice. Common examples: Doctor of Medicine, Juris Doctor, Doctor of Dental Surgery, Doctor of Pharmacy. Historically, certain advanced nursing degrees, such as Master of Science in Nursing and Doctor of Nursing Practice, have been grouped with these professional programs in terms of educational and financial aid policy. However, Department of Education's revised language no longer explicitly includes nursing within this category. Okay, here's implications. Limitations on financial aid. One of the most immediate and tangible impacts of this change involves student financial aid. Graduate nursing students, particularly those pursuing advanced practice degrees like MSNs and DNPs, which, by the way, and a little aside here, nurse practitioners is an advanced degree. These are where a lot of people that are birthing kids, most medical clinics, while they may have doctors, the nurse practitioners are usually the ones that you're seeing far more than you're seeing the doctor in those categories. Nurse practitioners are amazing individuals. Often rely on federal loans to fund their education. When nursing is no longer categorized as a financial or professional degree, students may face stricter borrowing caps under federal loan programs. This could lead to more reliance on private loans with higher interest rates, financial strain with students in programs requiring extensive clinical hours, reduced access to education for students from lower income backgrounds. These new regulations, professional students are eligible for higher unsubsidized loan limits under the direct loan program, 50,000 annually with the lifetime cap of 200,000. With nursing no longer explicitly included, nursing students may fall under the general graduate student borrowing limit, which is significantly lower, 20,500 annually and a lifetime cap of 100,000. The new legislation also removes Grad Plus loans, which many nursing students have used to cover education expenses that weren't covered by financial aid, according to the Association of American Universities. Barriers to nursing education. Graduate level nursing programs are essential for training nurse practitioners, clinical nurse specialists, nurse anesthesiologists, nurse educators, and nurse leaders. Many of these roles are critical to addressing healthcare gaps, especially in primary care, mental health, and rural and underserved communities. By potentially limiting access to affordable graduate education, the reclassification may result in fewer qualified candidates pursuing advanced practice roles, workforce shortage in areas already experiencing deficits, reduced pipeline of nurse educators, which limit how many new nurses can be trained. Okay, so currently there are 267,889 students enrolled in Bachelor of Science of Nursing (BSN) programs at 869 colleges and universities across the U.S., according to a survey by American Association for College Nursing. Many of these students may plan to pursue advanced degrees. Failure to do so could significantly impact the healthcare system's ability to meet future demands. Impact on broader healthcare system. As the largest part of healthcare workforce, nurses care across all settings from hospitals to clinics to long-term care and community health. Advanced practice nurses in particular help in expanding access to care in areas facing physician shortages. Any policy change that indirectly restricts entry into graduate nursing programs could have a domino effect across the healthcare system. These effects may result in longer wait times for patients seeking primary or specialty care, reduced capacity in educational programs due to fewer nurse faculty, increased burnout among existing staff due to staffing shortages. Given the U.S. healthcare system is already struggling with workforce shortages in many specialties, a reduction in supply of highly trained nurses may intensify these challenges. Okay, so let's break this down. Basically, according to a expert that I was listening to the other day, there are like 11 million people that we're short. We don't have those people. We need 11 million more people in healthcare to make it more viable, to make it better. We don't have that. But we do have 42 million people on food stamps in this country, a lot of which could go get a job that in, say, something like nursing. But not only that, you're making it harder for people to get this degree, which means you're going to have less people wanting to get these degrees. Think about that for a minute. You've already got a shortage. Now you're going to make it more difficult for the backbone of our healthcare system to gain more people. Now, there are a lot of nurses that get burnt out. There's also companies, such as insurance companies, that need nurses not for nursing, but for certain tasks that they need performed by a medical professional. Because these people are medical professionals, they're allowed to access information that normal people aren't allowed to access. They still fall under the HIPAA rules. And so, them having this ability to understand the information and have access to that information legally, it works for these companies. So, these nurses are coming out because they're getting burnt out or they're not seeing better opportunities out there. This is all leading to a massive shortage in our healthcare backbone. That being said, here is one thing that could possibly be a good thing towards it, but at the same time, I don't think that whoever included this in the big beautiful bill actually understood that this could happen. Those schools that are wanting to actually do good could lower the cost of this education. Think about that for a minute. School loans have already been proven to have, because of the access to school loans, that has actually been proven that it caused the price of education to rise. It's an indirect thing that is very provable, and schools did this so that they could make more money. And hilariously, a lot of this money is actually going towards athletic programs now. That annoys me. Even though I'm a major sports fan, that annoys me. So, while yes, some schools could honestly look at this and go, okay, maybe we need to lower the cost so we can continue this, other schools will be mad because they won't be able to profit off of this degree. That's going to hurt the chances of being able to get those students, which means that we won't have those kinds of nurses. Nurse practitioners are very necessary. There are degrees such as nursing informatics, which allows the next generation of nurses to learn how to operate in a more information driven world where they can understand all of the computer systems that are coming into healthcare. Basically, you're not going to have nurses that are going to have these advanced degrees, which further weakens our healthcare system. This one little change will have all of this effect. If we don't change this now and fix this stupidity, we're going to have some problems. There's already problems within our education system. We don't need our education system screw ups to lead to even more healthcare screw ups. But hey, this has been Paul, the Redneck Thinker, just giving you something to think about. So, folks, that's the story that I wanted to bring you on this video. And I just wanted to say thank you again for coming by. Hit like, subscribe, comment, all that fun stuff if you don't mind. Help me out. So, y'all have a good day now. Bye.